Every Monday, I tell you about the latest diseases spreading across the Tennessee Valley that could get your child sick. And for the last few weeks, when I called around to local doctors, they all have been saying the same thing: the flu, COVID-19, and RSV. Well, that's the same this week, too. But as a mom, I know these things can spread very quickly at schools. So in this week's What's Going Around, I wanted to dig a little deeper. So Mike Bailey, the co-founder of Indoor Air Care Advocates, joins me now to talk about how proper air filtration can control the limit and the spread of some of these diseases. So Mike, thank you so much for joining me.
Hi, thanks for having me. Yeah, first of all, we're just a grassroots parent group, and we let the school know about a UAB-administered ADPH-funded program to get those free air filters and replacement filters. And we also let them know about some advice from the Center for Green Schools, which is part of the U.S. Green Buildings Council, about how much noise these could make at various levels and what fan speeds are going to be appropriate for schools. And so they put 2 in each classroom so that they could have the noise levels be down, but have the clean air delivery rate be reasonably high in those classrooms, which are about the number one that we know about for quantifiable clean air being delivered to classrooms in the United States. They're getting about 560 CFM, cubic feet per minute, of clean air.
Wow, that is amazing. So my question is, when these filters, when they actually expire, what will happen then? And how much needs to be invested in order to make sure that this stays afloat?
That's a good question. I have spreadsheets that I could use to figure out the answer to that numerical question, but the answer is there is a bit of a cliff here, and I believe the school is working to figure out what will be the next chapter of introducing clean air into the classroom to try to make sure that the environment is not hostile to occupancy. We were told that there's a new way to get sick, and it's here to stay. And I think it's intuitive. You'd see a doubling of absenteeism if you introduced a whole new kind of flu. So they're doing something important to try to reduce that. But I'm not sure about the numbers. I'd have to get back to you.
Yep, no worries. And you know what? When you get that, we're going to put it all on our website at wavetv.com. Mike, I want to thank you so much for coming on. As you all can tell, this is definitely a very important public health issue. Well, you can go to our website for this episode as well as past segments that we've done on What's Going Around. For coverage you can count on, I'm Demetria Green, Wave 31 News.